Luke Laffin, Mike Gibson, coming to you live from ACC 2026, and we're talking about a phase 2 study, the Cardinal study of Tonlamarsen. I don't know much about Tonlamarsen. I hope you'll tell us a lot about it, Luke, in a trial of uncontrolled hypertension. Talk to us a little about the drug and what you did.
So we studied Tonlamarsen, which is an investigational antisense oligonucleotide therapy that lowers blood pressure by suppressing hepatic angiotensinogen, which is the rate-limiting step of the renin-angiotensin-aldosterone system. In this randomized clinical trial of 198 participants with uncontrolled hypertension, they had to be taking 2 or more drugs, and folks received a single dose of Tonlamarsen, so everyone got one, and then were randomized to monthly dosing or placebo. Monthly therapy for 5 months produced significantly greater suppression of angiotensinogen, about 67%, compared with 23% in the group that got a single dose and then placebo for the 5 months after. However, when we looked at blood pressure, the reductions were similar in both groups, about between 6 and 7 millimeters of mercury, suggesting that there's probably other additional biochemical suppression didn't translate to further blood pressure lowering. So overall, the relationship between angiotensinogen suppression and blood pressure reduction is probably a little bit more complex than we expected, and we need to do future trials.
This comes up all the time. Usually it's what does 5% mean? What does 6 to 7% mean in terms of blood pressure reduction and outcomes if you modeled it out?
Yeah, so even coming down to 2 to 3% millimeters of mercury of reduction in blood pressure has demonstrable benefits in terms of reducing strokes, heart attacks, all those things. So 6 to 7 can definitely do that. The way I like to think about it is that's about one blood pressure medicine, oral medicine right now. The nice thing about this is it's a once a month subcutaneous injection.
And is the relationship between millimeters mercury reduced and outcomes, is it linear or curvilinear? Do you asymptote or is it exponential? I mean, do we know the shape of that relationship?
It's generally linear. I mean, even amongst patients with normal blood pressure, if we lower it 5 millimeters of mercury, we still have a reduction in major adverse cardiovascular events.
Well, always good to see a once a month med to lower blood pressure. Compliance is a big issue. Luke, thanks for sharing with us today.
Thanks very much.